Right, Ange, you're one of our clinical nurse specialists on the colorectal team, and you're going to talk to us today about bowel function, aren't you?
Yes, I am, Julie.
Brilliant, because after bowel cancer surgery, life shouldn't revolve completely around the toilet.
No, it shouldn't.
So, how does bowel cancer surgery affect going to the toilet then?
When you have bowel cancer surgery, you quite often have a piece of bowel removed and that shortens your bowel. You can also have damage to the nerves and the muscles that supply the bowel. So you can have a looser stool, you can have urgency, needing to go more often, and frequency. You can experience spasms and cramps. You may feel you need to go to the toilet even when your rectum is empty. You may pass mucus or have more wind. You may also bleed from the back passage if you've had radiotherapy, and you may have soiling or leakage. Some of these changes may improve with time. It can take up to a year for your bowel function to improve, but it may be permanent. It may be what we call a new normal.
Right. So if patients have a new normal, but say I'm struggling from loose stools, what can I do to help that?
There are many foods that actually cause loose stools, and what we first suggest is that we cut out some of those foods to see if that improves your bowel function.
Right.
So if that's things like chocolate, fish, cabbage, spicy foods, nuts, lettuce, onions, fruit juice, caffeine and alcohol. And we would also suggest that you try and increase the amount of foods that you take that will actually thicken your stools. So things like apple sauce, overripe bananas, cheese, mashed potato, boiled rice, gelatin-based products, and peanut butter.
Brilliant. All my favourites, though, will cause me loose stools, so I have to give up my alcohol and chocolate, or I can just take little amounts. Is that right?
That's right, yes.
So, Ange, if I've got loose stools, I've heard that I should change my fibre intake, but is fibre really a friend or a foe?
Well, understanding fibre can actually help improve your bowel function. There are two types of fibre, Julie. There's soluble fibre that dissolves in water. This is oats, the fresh of fruit and vegetables, and ripe bananas. This slows your bowel transit and helps absorb nutrients and reduces your cholesterol and glucose. And then there is insoluble fibre. This adds bulk to the stool and speeds up your bowel transit and causes wind. This is the skins of fruit and vegetables and some salad foods, brown and granary bread and potato skins and brown cereals.
So if I got this right, if I want to eat an apple, the outside peel is insoluble fibre that'll speed up my digestion, and the fleshy bit, the middle bit, is insoluble fibre, and that can actually help by bulking things up.
Yes, that's right, Julie.
But Ange, what is transit time? You talked about transit time.
Transit time is the time it takes for the food that you eat to go through your bowel and come out in your stool. And when you have loose stool, your transit time is very fast.
Right. So is there anything else I can do apart from diet to help with this?
Yes, there are quite a few things you can do. There is a medication called loperamide. You might know it as Imodium. And if you take this 30 minutes before you eat, this actually slows down the transit time of your gut. You can get Imodium in several forms. You can get it from your GP. It can be in tablet, or it can be a melt, or it can be a syrup. Quite often it's useful to adjust the dose. You will find out what dose is pertinent for you. And you can speak to your clinical nurse specialist. You can also use a laxative, and now this sounds very strange, but Fibrogel or Normacol are soluble fibre, so they will actually bulk out your stool and actually slow down your transit of your gut. To take this, you do need to drink about 2 litres to 3 litres of water a day.
Gosh.
You can also use pads and barrier creams, and if you're still struggling with your bowel function, you do need to speak to your clinical nurse specialist.
Okay. So, other problems patients have asked me about are fragmented stools. So I've had some patients say to me, they get up, they go to the toilet, they sit down to eat their breakfast, then they've got to go out to the toilet again. They just sit down to their Weetabix and they've got to go out to the toilet again. And literally that continues. So they can spend a couple of hours on and off the toilet doing little bits frequently. And I know it sounds funny, but when it's on a daily basis, that can be a huge problem. Have you got any tips for those people?
Yes, of course. Your rectum stores your stool. So if you have surgery, this can actually reduce the storage, so you get these fragmented symptoms. and this can be called anterior resection syndrome. You might hear this. Now, how to help it, you can use bulking agents. So soluble fibre, as discussed before, can actually bulk the stool out, fill the bowel, and you get a continuous motion instead of lots of little motions. Also, undertaking pelvic floor exercises can help muscles that have been impaired from surgery and improve your muscle tone and your control. You can ask for help and advice from your clinical nurse specialist, and we can get you a referral to the continence advisor if necessary.
Brilliant, thank you very much. So what about constipation?
Constipation can occur post-surgery. Some patients suffer quite badly from it, and they need to increase their water intake, and they may need a stool softener as something to help the stool through the bowel. And they may need to increase their insoluble fibre in their diet.
Okay, and wind. I have had a few patients really talk to me about wind.
Okay, there are several non-food causes of wind, and patients quite often have wind post-surgery. If you chew gum, you eat with your mouth open, you have lots of fizzy drinks, you drink with a straw, or you smoke, or you eat irregularly, you may end up with lots of wind. So top tips to reduce this, obviously, is to eat regular meals, small and often. Don't talk when you eat, don't drink when you eat. If you're going to want anything fizzy, let it go flat before you drink it. And using live yogurt, having a pot of live yogurt a day actually reduces your wind.
Brilliant. Now, I have heard that there is a correct position to go to the toilet in, which sounds a little bit odd to me. I just sit down and go. Is this right?
Yes, it is. There is a position that actually helps your rectum empty. Particularly, it's quite useful if you've had surgery. So you need to sit down with your knees higher than your hips, lean slightly forward, put your elbows on your knees, keep your abdomen flat, and keep your back very straight. And this helps empty the rectum, and that can help if you're having problems with fragmentation.
Brilliant. So all these things can help a little bit, but adding them all together can make a huge difference to quality of life. What about, I have had a few patients say to me about smelly poo and odour with their poo. Now, obviously, we can't make it smell of roses, but is there anything people can do for that?
Yes, there are some foods that actually increase the odour of your stool. So if you particularly are worried about the odour, you can reduce the amount you take. So things like beans, broccoli, fish, cheese, cucumber, eggs and onion will make your stool very odorous. You can have, again, live yogurt is very good at reducing the odour of your stool, and buttermilk. And some patients take peppermint oil capsules, which can be purchased from the health food shop, and they can help as well.
And I think stoma patients sometimes have this problem because their nose is a bit nearer the bag, whereas obviously it's further away from your rear end. Is that right?
Yes, that's right. And for stoma patients, we can say to them there are also drops that we can put in their bag to help with the smell.
Right. But I think at the end of the day, we've got to remember it's normal for poo to smell.
It is.
And don't be too embarrassed. Right. I also have patients say to me that they've had problems passing urine after bowel cancer surgery. Now, this seems a bit odd to people because obviously it's a totally different system. What can you tell us about that?
Yes, quite often the nerves that control the muscles to your bladder can be damaged during surgery. And this may result in a loss of control, leakage, difficulty emptying your bladder completely, a delay in starting going for a wee, a weak stream or frequency, and sometimes retention where you can't empty your bladder at all. Post-surgery, many patients have had a urinary catheter and they've had an infection, and this also may affect bladder function. Pelvic radiotherapy also can cause inflammation around the bladder and problems later.
Okay, so what can people do about this?
So the main thing to do is drink plenty of fluid and drink the right kind of fluids. So avoid alcohol and caffeine and drink 2 to 3 litres a day. If you have any blood or burning or stinging in your urine, you do need to seek medical advice because you probably will need a specimen taking. You can speak to your GP or you can speak to your clinical nurse specialist about your problems.
Brilliant. Now, I have heard that there's a special card that you could use to jump the queue for the toilets. Is this right, Ange? And if so, where do people get this from?
Yes, there is a Toilet Macmillan card that you can get from your clinical nurse specialists, and this is a little green card which says that you have a problem, whether it's bowels or urine, it doesn't matter, and if you show it when you're in a queue for the toilet, most people will let you go first. We've had a patient who was outside the Ritz in London, and they were desperate for the loo. They whipped out their Macmillan card and they were ushered into the toilets at the Ritz. So you can use your card. It is at the discretion of the management whether you can use their toilet, but most of the time people are quite kind and understanding and realise that you have an urgent need.
Thank you very much.
Okay.
Thank you.
Thank you.